The normal human body has 206 bones, which are necessary for a variety of functions within the body. Without bones, we would essentially look like jello. Bones offer support, protection of major organs, movement, and blood cell production. But what happens when our bones don't do what they're supposed to do? There are numerous types of bone deformities and diseases that prevent the skeletal system from doing its job. A deformity is defined as a distortion or a disfigurement. A disease is defined as a medical condition that is an abnormal condition of an organism that impairs bodily functions. One of the most common bone diseases is arthritis. There are over 100 different forms of arthritis, and over 40 million people in the US have one type or another. Arthritis is defined as being the inflammation of one or more joints. To fully understand arthritis, we have to understand the structure of a joint. Joints are where one bone moves on another bone. Ligaments keep the bone in place and hold the two bones together. Cartilage covers the bone surface to prevent the two bones from rubbing directly against each other. A capsule called the joint cavity surrounds the joint. The joint cavity has synovial fluid, which is produced by the synovial membrane, which lines the joint cavity. When a patient has arthritis, something is wrong within their joints, whether the cartilage be deteriorating or lack of fluid. The signs and symptoms of arthritis depend on the type of arthritis at hand. However, the most common signs and symptoms are pain, swelling, redness, and decreased range of motion. Some arthritis-related disorders can be 100% cured with proper treatment, while most are long-term. Treatment for arthritis includes surgery such as arthroplasty, joint replacement, prescription medications such as steroids to reduce inflammation, and physical therapy. A type of bone deformity is osteogenesis imperfecta. Osteogenesis imperfecta is a condition that causes bones to be extremely thin and fragile. Because the bones are so fragile, the risk of fracturing a bone greatly increases. This deformity is caused by a defect in the gene where it produces type 1 collagen. There are three types of osteogenesis imperfecta. Type 1, or mild osteogenesis imperfecta, is the most common form. People with type 1 tend to live a normal lifespan. Type 2 is a severe form that normally leads to death in the first year of life. Type 3 is also severe. The majority of people that have type 3 have many fractures starting out in an early age and can have more severe bone deformities. Most people with stage 3 osteogenesis imperfecta are in wheelchairs and have somewhat short lifespans. The signs and symptoms of osteogenesis imperfecta is a blue tint to the whites of eyes, multiple bone fractures, early hearing loss, and loose joints. However, those with a minor case may never know they actually have it. There really is no standard treatment, but specific therapies can reduce pain. In severe cases, metal rods are inserted into the body surgically to aid the skeleton. Another bone disease is osteoporosis. Osteoporosis is a disorder of bone metabolism that causes the loss of mass in the skeleton with a subsequent weakening of the bone. Osteo comes from the Greek word osteon, which means bone, and poros, which means passage, which in this case is an enlargement of spaces in bone. Osteoporosis is also the most common bone disease. Approximately 25 million Americans had some form of the disorder, though there are actions you can take to prevent osteoporosis. Osteoporosis is caused by a loss of bone mineral density. This happens when there is an increased porosity of the cancellous or spongy trabecular bone and a decrease in the thickness of the cortical compact bone. Signs and symptoms are back pain, loss of height, fractures of the hip, wrist, spine, as well as losing or loss of teeth. Typically, people's first indication of the disease is a fracture that results from minimal exertion. There are no standard treatments for osteoporosis, though experimental experiments include calcitonin, sodium fluoride, and coherence therapy.
Is it supposed to be curved like that? Hey, Steve, get that thing straightened out.
Well, what are they talking about? It's not curved, is it, fellas?
All right, first, I'm not looking down. And second, they're talking about your spine.
You've got scoliosis.
Scoliosis is a deformity where the affected patient has a curvature of the spine. The curvature can be moderate to severe. Any part of the spine can be bent, but the most common areas affected are the chest area, thoracic scoliosis, or the lower part of the back, lumbar scoliosis. In the UK's National Health Services, about 80% of the cases, the cause was unknown. Scoliosis signs and symptoms in children include uneven shoulders, head is not directly centered but to the pelvis, uneven leg lengths, and their clothes do not fit properly. Most people with scoliosis can live full, productive, and normal lives. Treatment for scoliosis is determined by the severity of the curvature. The goal of treatment is to prevent spinal curve from getting worse, so most commonly a back brace is used in an attempt to correct the spine. Lastly, Gorham's disease is a very rare but brutal disease. It is a disorder in which one or more bones are progressively replaced by tissue consisting of lymph vessel tumors. The cause for Gorham's disease is still unknown. Numerous charities have been started to fund the research pertaining to Gorham's disease because the knowledge of it is so limited. The signs and symptoms of Gorham's disease depend on what part of the body is affected. Fractures are common, as well as persistent pain in part of the body that is affected. The way how Gorham's disease develops over time varies. It can regress without obvious cause. If vital structures of the body are affected, such as the area that supports the lungs, it can be much more serious. If a bone is still undergoing growth, doctors may advise no treatment. Bone grafts, synthetic bones, and radiotherapy have been used as treatment to improve the functional use of the affected area.
The ocean's deep, she knew that much before she had just gone to leave.